You believe you have chlamydia and you came here, which is the right decision. Yes, do not be stressed. It's going to be a-okay. I'm going to take care of you. And even if you do have chlamydia, we'll treat it and it will go away. So don't worry, it's fine. You made the right decision. Now sit down. Let's start with your name and date of birth. Great. Well, you're at that age, when it's kind of common to, get some STDs along the way. I'm not here to judge you. Now, as for your medical history, I assume you asked ChatGPT, which is the reason why you came here and you think you have chlamydia. So, when did you first start noticing symptoms? And please describe to the best of your ability those symptoms that you are experiencing. Okay. Well, yes, it leads me to believe that you may have some minor infection, but we're not done yet. Let's continue. Are you experiencing any pain or discomfort during urination? Yes, that means when you pee. You're so bright. Okay, well, amazing. I mean, this is not a comment on your answer, rather on the fact that you are willing to answer, which I commend. I find it absolutely admirable. Now, do you have any unusual discharge? I will ask you to give me details about the color, smell, and amount. We're both women here, no need to be shy. We've all been there. Any lower abdominal or pelvic pain? Okay. Now, when it comes to sex, have you had any abnormal bleeding between periods or after sex? So, are you regular when it comes to your cycle? How long does your cycle last? Oh, you have an app, just check it. Oh, that's regular. You have some bleedings in between or after coitus. Yes, that means sex. Sorry, I like to use doctor words to, make it a little bit official. It is official, but I'm just saying it looks kind of cool, sounds kind of cool. Have you noticed any pain of any kind during sex? I'm assuming you're sexually active, obviously. If you're not, you should tell me as well. Okay. Now, have you had chlamydia or any other STIs in the past? Okay. And finally, are you currently experiencing any other symptoms? It could be fever, it could be nausea, Okay. Now, let's move to the dates. Let's move on to your sexual history. Non-judgmental. Don't worry, I'm not here to judge you. I have nothing to say anyway. I have no judgments. How many sexual partners have you had in the last 6 months? I mean, that's admiration, honestly. Do you use protection constantly, like condoms or dental dams? Look, I know, most people don't use protection for that, but you should be aware that you could get an STI even if you're just using that and not this. Do you understand what I'm saying? Right. So either don't do it or get them to wear a condom. Now, 11, do you have sex with men, women, or both? Obviously, I'm talking about sex, not gender. This is completely different. Yes. Have you had any of your partners testing positive for an STI? Ooh, your situationship. He was cheating on you? Well, if I understand the term situationship correctly, I don't think they can cheat because you are not exclusive, right? Which is why you should always use protection with a situationship. I tell my patients all day long, a situationship is not exclusive. I mean, you have to expect them to be getting it elsewhere. So you found out he was sleeping with other people without protection and he got an STI. Rude and inappropriate. You should, well, not break up because you're not dating, but stay away from that person. Do you know if any of your partners had symptoms, the same symptoms that you described to me? First off, I just want to congratulate you for going out there, calling your partners, telling them about your symptoms, being open and communicating about this, because most people will feel like they're a bit embarrassed. It's never something that's nice to talk about or to admit when you have contracted an STD or an STI. So props to you. Okay. And finally, this is just for the test. Have you had oral or anal sex recently? This is just so I know what we're going to test you with. Okay. Alright, so I'm gonna give you this little cup and I'm gonna ask you to pee in it. Then you'll have to do your own test by basically inserting the 3 sticks. I will give you. They're very thin. You're not going to feel anything depending on your practice. Okay, come back in a bit and I'll check your results and let you know. Alright, this is time for your treatment and follow-up. Yes, ChatGPT was right. You have chlamydia. Congratulations. Don't worry, we're going to fix it super quickly. But before I prescribe you with anything, are you allergic to any medication? Like azithromycin or doxycycline? I'm foreign. Sometimes it's hard for me to pronounce the medication names. When was your last STI screening before this one? Yes. Great. Every year, every 6 months is great, especially if you're active. Do you know how to contact your partners so they can get tested and treated too? Amazing. Are you currently pregnant or could be? Great. Yes, it impacts the treatment choice. Do you have access to a pharmacy or need assistance with treatment access? Great. Alright, I'm going to have your treatment all written out. Your prescription is gonna come out that way. You should be all good within 3 weeks. Try not to have sex. It would be best to just not have any sexual activity for the next 3 weeks and you'll be done and healthy. You good? Great. Yes, I do.